Namaste. Today I am going to discuss about a study because one of the subscribers messaged me and they wanted to know how yoga can help in irritable bowel syndrome. And specifically IBS-D, that means irritable bowel syndrome with diarrhea. So I thought of presenting this study, a very interesting study. And the title of the study is Yogic versus Conventional. I was just putting on my digitizer. Yogic versus conventional treatment in diarrhea, predominantly irritable bowel syndrome. And this study was conducted by these authors from India, Indu, Deepak, Pujari, Acharya, Pandey, and Sharma. And these are from one of the India's premier institutes. And why I chose this study? Because I wanted to give you a protocol. What yogic asanas and pranayama should be done in order to deal with this illness of irritable bowel syndrome, and specifically focusing on diarrhea because this is what the subscriber wanted to know. So this is a scientific study, but through this study we would explain how and which yogic asanas you should do in order to deal with IBS. So this is a screenshot of the study and the affiliations of authors. And if you see here, the authors are from All India Institute of Medical Sciences. And also one author is from Central Council of Research in Yoga and Naturopathy. So authors are reputable. They have followed the protocols. So let us understand, what do you mean by irritable bowel syndrome? In a technical term, you could say that it is a chronic gastrointestinal motility disorder. That means either you may have a diarrhea or you may have constipation. Now, what we are looking at specifically is IBS-D, which is concentrating on IBS diarrhea. And what are the symptoms? Symptoms are like increased frequency and loose consistency of stool. There is bloating, abdominal discomfort, and the pathophysiology is very complex. There is an autonomic nervous dysregulation. There are psychological factors also attributed to it, like high anxiety or stress. And also there is visceral hypersensitivity. So for treatment, there is a challenge. The conventional treatment, what exists, provides incomplete relief. And most of the patients seek alternative therapies like yoga. But the problem here is we need to know which yogic asana is beneficial for it. So you may not have your yoga instructor or yoga therapist may not have an evidence to provide which asanas you should do in order to cure this particular illness. So we need to be thankful to these researchers, because these researchers, out of so many asanas and pranayama, took out some asanas which can impact or which can be useful to treat IBS-D. Let us look at the study in a bit more detail. Now, this is a RCT, what we called as randomized control trial. In studies, randomized control trials hold gold standards. That means the evidence is quite strong. Now, in this study, interestingly, 22 male patients participated in this study, and there was no females participated in this study. So you could say this could be one of the limitations, but still it provided us evidence that this yogic protocol, what these authors have suggested, may work. And if you look at the range of age, the age spectrum is from 20 years to 50 years. So you have quite a wide spectrum of age range. And they divided the participants into two groups, what is called conventional group, which is DC. Number of participants in that group was 12. Out of that, 1 dropped out. Second group was yogic group, abbreviated in this study as DY, and there were 9 in this group. So altogether, here it was 11, it was 1 dropped out, and other place it was 9. And what was the protocol followed? In the conventional group, they gave this medicine, loperamide, 2 to 6 mg per day. But this is a conventional medicine which is used conventionally, those yellow color tablets, the capsules which are available in India. And in the second group, where the yogic group, they only gave this yoga protocol. And this yoga protocol was done twice a day. And what did they measure? They took measurements at the start, after a month, and after 2 months. So that means this study was measured various parameters at the start, at 1 month, and after 2 months. So the entire study lasted 2 months. And they measured the bowel and autonomic symptoms, anxiety. They measured both trait anxiety as well as state as well as trait anxiety was measured. They measured autonomic reactivity, gastric motility, and physical flexibility. So these were the measurements. So they divided into 2 groups. Group 1, which was a conventional group. Group 2, which was a yogic group. And it consisted of participants 11 in the conventional group, 9 in the yogic group. And in the conventional group, they gave the standard treatment, which is loperamide, which is around 2 to 6 milligram per day. And for the yogic group, they gave a protocol. So why we are discussing this in detail? Because I want to bring it to you that yoga is just not done randomly based on only observational studies, but also from an experimental point of view. In IBS-D, this protocol was found effective. Now, in the yogic group, they followed a structured yogic intervention program, and this was done twice a day for 2 months. So if at all you want to use yoga as a therapy, you have to be systematic. You have to do 2 times a day, and also you need to do it regularly for minimum 2 months before you can get results. What did they do in yoga? They practiced Surya Nadi Pranayama. We will discuss what are those. And they looked at 12 specific asanas or postures, which was used together in the yogic protocol. How to practice Surya Nadi Pranayama? You need to sit comfortably in any asana, Sukhasana, Padmasana, Vajrasana. All you have to do is block your left nostril and inhale through the right and exhale through the right. And the rate of inhalation and exhalation is normal. And you have to take one inhale, one exhale is 1 round. So like this, you have to do for around 27 rounds. So inhale, exhale. You can keep your eyes closed for a better effect. So this is as far as the Surya Nadi Pranayama is concerned. And there are scientific rationale behind choosing this pranayama for IBS-D patients was that it decreased the sympathetic tone in the body. And this right nostril breathing is a mild sympathetic stimulation. So these asanas are not just chosen randomly, but with a particular scientific rationale in mind. Because sometimes we do yoga and we say there is no result. It is because that particular asana was not chosen scientifically. And the goal is to rebalance autonomic nervous system. This is the pranayama. And then there were 12 yogic asanas which they did. So first part talks about sitting and kneeling asana. The first asana is called as Vajrasana or Thunderbolt asana. Sit down and kneel. Keep the buttocks on your heels and both the hands are on it. Now, this boosts the digestive system. The second asana, Shashankasana or rabbit pose, they recommend two types of variation. The first variation is taking the hands behind and catching, and then from the Vajrasana, you just bend forward, touching your forehead to the ground. The first variation. The second variation is you keep the hands down and then try to touch the head to the forehead. Now the difference between both this is that the way you keep your hand. The first one, the hands are tied behind. The second one's hands are in front. And while doing that, press the fist into the abdomen. Make like this, put it in the abdomen and press the head to the ground. Now, the first variation, it tones the pelvic muscles and regulates Adlerine glands. And in the second variation, enhanced abdominal massage by virtue of this hands into the fist into the abdomen. The next asana was Paschimottanasana, seated forward. You just sit down and make straight the legs and bend towards, touch the head towards the knee and try to catch the hands towards on the both the toes. Now for a beginner this might be difficult, but over the time period you will be able to touch it. But the motto here is not perfection. What you see here is the most perfect asana, but the motto here is trying to do it in whatever possible way you can do it. Even sometimes your hands may be here, it's fine, but then you are getting the effect the moment you try with this particular asana. Now, what is the benefit of it? It tones the abdominal organs. The next set of asana is prone and spine arching asanas. Out of this, Bhujangasana, cobra posture, lie flat on the stomach and lift the chest off the floor. You could see the arc, and you could see that the person in this case is looking at the sky like a snake which has taken the hood out. It compresses abdomen and fresh blood flows into the abdomen region. All these asanas have to be done initially for 30 seconds and maximum you can do it for 1 minute. Next asana is Dhanurasana. Lie flat on the stomach and hold ankles and lift your chest and thighs. Initially, it is difficult, but over a period of time, you would be able to slightly lift your body and you would be able to maintain it. This is a powerful abdominal massage. The next one is Marjaryasana, or what we call as cat pose. Now kneel and on all four, now both the knees and on the hands. When you inhale, you go, you take the head backward, and exhale, you make the curve of your vertebrae. So you would say this is exhaling, and while inhaling, you would see it is like this. A very good asana for increasing the spinal flexibility. The next asana is called as Ustrasana, camel posture. You kneel down, take one hand and touch on one heel, other hand on the other, and take the head slowly down. It stretches the stomach and intestines. Now, the last group of ones were standing asanas. So you saw 4, 4, 8, and the last 4, 1, 12. This is called as Padahastasana, hand to foot. You stand up and touch the hand to the foot, and your head is touching to the knees. Now this improves digestion, relieves constipation. The next one is Trikonasana, triangle pose with variation 1 and 2. In the first variation, you will both the hands on the hips, and then you just try to bend towards one side and touch the hands towards the heels. Next time on the other side. Now this variation 1 stimulates the nervous system and digestion. The second variation of Trikonasana, you just kneel down, take your head in front and keep both the hands spread out, and then touch this to here, and then in the second round, and if you see here, one hand is behind. Now the next round, this hand will come here and this hand will go outward. And this is a deep twist for the organ massage. And the last one is Pavana Muktasana, or what we call wind relieving posture. You lie on the back and then take one leg, catch the leg with both the hands and try to touch your chin to the knee. Similar way for other leg. Do it for 2 to 3, 5 times. Each leg 3 to 4 times. And then you take both the legs together and do this by touching the knees to both the knees. And then there is a variation of it wherein you try to rock around and so on. But these are advanced one. Once you get your expertise in the basic ones, you would be able to do that. But for this protocol, they practiced this 12 asana plus 1 pranayama, that is Surya pranayama, what we call as Surya Nadi pranayama. After doing this, what was the results? In terms of bowel symptoms, both groups showed significant reduction in diarrhea. Yoga group and loperamide group both were equally effective in primary symptoms. So please keep in mind, in one group there was medicine given, other group there was yoga given. So yoga has performed, the participants who did yogic protocol, that is 12 asana and 1 pranayam, the Surya Nadi pranayam, they could bring down these bowel symptoms. In terms of state anxiety, both showed significant reduction. Yoga showed improvement within 1 month, and this is faster than the drugs which were being taken. Both have positive psychological impact. The one is yoga and other one is drug. In terms of autonomic impact, now in autonomic symptom score, concepts like sweating, dizziness, etc. were considered. In the conventional, the one with medicine, it was noted that it did not impact the autonomic symptom score. Whereas a yoga group showed a significant decrease. And this is a statistically significant decrease at a level of significance of 0.05. That means you don't have to bother about statistics, but what you have to keep in mind is that, like, in terms of autonomic symptom score, the yoga group experienced a significant decrease. And the yoga group had a broader effect on general autonomic function. In terms of parasympathetic reactivity, conventional group, there was no change. Whereas in yoga group, there was a significant increase in the parasympathetic tone. Now, this is a very startling finding because yoga normalizes autonomic imbalance rather than just suppressing the symptoms. What in naturopathy we used to always tell, don't suppress the symptoms. Whereas this is a very, very startling finding by this group of researchers who have done it. Though this study was published in 2004, it was not very commercialized because definitely there are no business activity in it. It's yoga, you can learn it and do it. Whereas there, other place, you can sell it as a product, a pharmaceutical product. Now, in terms of divergent effects on gastric activity, they measured what we call as electrogastrography, what we call in simple terms gastric motility. For the conventional group, there was a significant increase in EGG amplitude. Underlying gastric hyperactivity still persists. Whereas you look at in this yoga group, it was lower, more normalized EGG amplitude. And this helps calm underlying irritable gut activity. And this shows that this treatment can be used for a better long-term control. Isn't this an amazing result? So what conclusion can you draw out of it? Yoga provides a broader therapeutic benefits than drugs alone. It addresses the physical, psychological, and autonomic aspects of IBS-D, that is IBS diarrhea. And This study also proposes a mechanism of yoga, and they try to explain why does this happen. They argue that the physical massage, asanas, mechanically massage the organs. The autonomic rebalancing, it normalizes the nervous system. And brain-gut modulation, it reduces stress, breaks dysregulation cycle. And from a clinical point of view, a structured yoga is almost equivalent to a pharmacological intervention. It lays basic foundations that how yoga can be used for IBS. Indeed, we should thank these authors for carrying out this study. Because as a common man, we want to use holistic medicines. Holistic interventions like yoga. But what type of asanas to do? What type of pranayama to do for a particular illness? Such type of study gives a guideline. So that is why, though there are some scientific words, but if at all we want to take charge of our health, we need to be proactive. We need to read, we need to understand which of these asanas or pranayams or pratyaharas or yamas, niyamas is going to impact our illness or our maladies. So before I end this video, I want to go back to the protocol once more. So in terms for IBS-D, one of the best protocol or treatment is Surya Nadi Pranayama, breathing through the right nostrils, 27 rounds. And in addition to that, Vajrasana, Shashankasana variation 1, 2, Paschimottanasana, Bhujangasana, Dhanurasana, Marjariasana, Uttrasana, Padahastasana, Trikonasana variation 1 and Trikonasana variation 2, and at last Pavana Muktasana. These 12 asanas plus 1 pranayama can be used for managing IBS-D. So whether you are a yoga therapist or a yoga instructor, or even a patient or somebody who wants to do it in a scientific manner to reap the benefits for IBS-D, use this protocol. So once again, I thank these researchers for providing these evidence-based guidelines. I know this video has been a bit long, but when you are looking at a scientific study, you have to look at it in detail so that it can help us. So thank you very much for joining. In case like this you require more videos, please put in your comments. I will come out with such scientific videos. Thank you very much. Again, namaste.